Hello and welcome to another episode of Everything Digital Health. I've been away for a little while, partly holidays, partly being busy with work. Some interesting developments which I will bring to the channel in a couple of weeks, but can't bring just yet. Some very interesting new projects that I've been doing in open source, just building Rust CLI things mainly, but all of interest for the digital health crowd. So apologies for the gap between this and the last episode. It's been getting on for 2 months since I last recorded anything, but I'm expecting to sort of get back up to a decent cadence of, kind of an episode a week or thereabouts. Today, it's kind of an update show. Nothing massively new, but for those of you who've been following the NHS open source policy situation, last year I reported on the fact that the NHS England had removed all its open source policies sort of without there being any kind of announcement about it, just in a very blunt and it's got nothing to do with anyone else kind of attitude. What we do is what we do. There was no official announcement or explanation for it. And that was in about October 2025. And at the time we thought it's odd, but maybe it doesn't mean anything. Although it was reported by some of the digital health press and picked up, but we then left them to it for a while. And then in end of April, early May, they announced that they were going to close source a whole load of repositories for what is quite spurious reasons, in that the security argument, the mythos is too powerful argument for closed sourcing your repositories is something that's been debunked by pretty much everybody who knows about cybersecurity. Hiding your source code, especially when it's previously been open, adds nothing. So it's previously been open, so it's part of the training data, or it's available on the web somewhere. But even if it's always been closed source, there's absolutely nothing to stop a Mythos class or even just Claude Opus 4.8 from decompiling binaries or from working out vulnerable portals and things from websites and things. All of that stuff is still out there. And even in a closed source environment, you're just as vulnerable. In fact, you may be more vulnerable because you have a false sense of security, because you think, oh, well, no one can find any of these things. Well, somebody will. With enough bad guys out there, somebody will. I can understand that NHS infrastructure is critical national infrastructure, and so there's a high stakes argument to it. And I can understand that it's a honeypot as well, in terms of medical data about UK citizens would be of high value in terms of, say, ransomware. But given that already happened in WannaCry, and I don't think we really learned the lessons of WannaCry, which is now 9 years ago, we're probably not that much less vulnerable than we were. I would have said that the open source repositories in the NHS were not the place that you would attack us anyway. I mean, most of those repositories were not actually the critical code that's running our electronic patient records and that sort of thing. And in fact, a lot of our electronic patient records are closed source, proprietary, have never been open source. But from what I've heard about the programming and infrastructure practices at some of those companies, they are a wide open target. So if you were going to worry about any particular part of the NHS's critical national tech infrastructure, it wouldn't be the open source bits, is what I would say. Anyway, they closed source 218 repositories at the middle of May sometime. And that put into chain some requests for information. So I put out a Freedom of Information Act request about the governance of the engineering board, and Terence, who's a known open source advocate in the tech space in the UK, put out a similar FOI that was more about the details of the decision behind that particular ruling. Let's cover off Terence's FOI request. So he asked for information relating to guidance SDLC-8. And I will put links to all this in the show notes so that you can check it out yourself and follow up And obviously, the more of us that can get interested in this, the easier it is for us to show that there's a public interest reason for disclosing some information. Terence asked for some information about this internal guidance, SDLC-8, which I believe stands for Software Development Lifecycle 8, and I presume 8 is kind of a number of that ruling. It was called a red line, I think, so maybe this is red line number 8, in which case it'd be interesting to know what the other 7 were and if there have been any since. So all source code repositories must be private by default. Very shortly after this was released, gov.uk released some guidance which said it makes no difference and that a private by default approach is not a security stance. It's just hand waving. Anyway, Terence asked for some quite reasonable things: minutes of meetings, emails, messages, communications about this guidance, some of the lists of the public repositories, which, given that they're public repositories, shouldn't really be a problem to release them because they're already public repositories. It's a list of public repositories. And a copy of the criteria used to assess the impact of these changes. I think that's quite an important thing because these repositories were depended on by some other projects, which might be within the NHS or they might be at other companies. And as an example, if NHS England produced, say, a library of open source code that is used in some other third-party piece of software, and then they suddenly disappear the availability of that software and close the source code, that could really impact the delivery of other pieces of software. And so we don't really yet know what the impact of this will have been. And I suspect that given the difficulty we've had getting more information out of them with these FOIs, I think it's going to be pretty difficult to get any details about impact. But the long story short, they kind of said no to all of this. So it was reviewed, and Section 24 exempts information if doing so is required for the purposes of safeguarding national security. And I got to say that's a little bit sort of CIA national security cosplaying on behalf of NHS England here. I mean, yes, the NHS is critical national infrastructure, as I've said, but releasing the rationale around why you close source some of your stuff, especially when it directly contravenes the rationale that other parts of the government are saying, I don't think that actually really releases any critical insights into your organisation's security posture. Or maybe it does. Maybe things are so bad at NHS England that them telling us how they make decisions would leave them wide open to cyber attack. I think a lot of this is essentially overreach. And they weigh up the public interest arguments in favour, and then they write the arguments that they really want, which is the ones in favour of withholding, and they make sure that there's a couple more of those, and then they say, no, sorry. I mean, we all agree with quite a lot of this kind of stuff. That sentence on its own, successful cyber attacks which disrupt digital systems in healthcare could result in disruption or delays in the delivery of safe patient care and potentially lead to patient harm or loss of life. Well, you can't argue with that. It is true. But the question is not that. The question is, does releasing information about SDLC-8's decision-making process actually make it more likely that there would be a successful cyber attack? And I think what we're contending as an open source community is, firstly, no, it wouldn't make it more likely. And secondly, that the whole process of closing down these open source things makes no difference either. So what they're doing is fiddling while Rome burns. There are definitely areas of the NHS and its technical infrastructure which would benefit from improved cybersecurity. And it probably isn't the open source bits that we're talking about. Terence's Freedom of Information Act sort of largely rebuffed, but I wonder if perhaps a second attempt with some different language might make it harder for them to turn it down, because I think we still need to see that information. I went for a slightly different line. I wanted to know about this engineering board, because this is the first time I've heard about an engineering board in the NHS. I've been involved in NHS England Digital HSCIC for nearly 2 decades, and I've never heard of the engineering board. So apparently there is one. I asked for the terms of reference. My initial request was 8 points and was probably a bit much to ask. Long story short, they said that's too much. It's going to take us ages and ages and ages, and so we're going to say no. So I said, okay, just confine your answer to the first 3 questions, which were quite straightforward and should basically have been about giving me access to existing documents. We managed to get that from them. So we have an engineering board terms of reference redacted. The redactions are probably reasonable, although we can't actually see what was redacted. We've just got missing bits. But the redactions are to protect the privacy of people who are not already in the public eye, and that's allowed. So the names, for example, of the members of this engineering board have been redacted. We have the name of the SRO there. And we've got some fairly generic information about the engineering board. Now, what it said was that this document has been transferred from an internal version control system into Word for the purposes of sending it to the FOI. So we have only their word on that. Maybe we believe them that there was a terms of reference before the 23rd of June 2026 when they had to make it into a Word document for the purposes of the FOI. Maybe there was, maybe there wasn't. There's a list of things that it does. It doesn't tell us anything about the membership of the engineering board. I did ask if they can't tell me the names. I asked for their affiliations, as in, what parts of the NHS are they from and what do they represent? What's their job titles? But it appears we're not allowed to know that, presumably because it's critical national infrastructure cybersecurity reasons. So it doesn't really help us to know whether there's any kind of nefarious influence going on here, because one of the concerns that I think I have is that there are very large corporations fiddling about inside the NHS's tech infrastructure and making decisions that benefit commercial interests. And certainly closed sourcing everything benefits commercial interests, because open source is seen as a threat to commercial interests. It shouldn't be seen as a threat to commercial interests, because commercial open source software is definitely a thing. I've been working with that for over a decade. But we are where we are. The declaration of interest stuff is interesting because there is a register, and we will be asking for that register. At the very least, we'll be asking for the bits that are not the name, so anything that's not personally identifiable. The engineering board will meet monthly, which is interesting because there have been no minutes of it, although there were some online references to an engineering board meeting, but there were only 2. So given that we should have had over 20 meetings between February 2024, or nearer 30 meetings, it's odd. So we've got some information. We haven't got other information. I will be reviewing this and putting in a follow-up. But I think it's a mixed picture, really. I think it tells us that we managed to get some information out of them. I don't think that anything has helpfully been explained here in terms of the rationale. And I think the engineering board can either hide inside their organization and pretend to be anonymous, and you pull levers that make it difficult for people to get more information about the decisions that are taken on our behalf with taxpayer money and for the benefit of the country. But I think they would actually just be better off being very transparent and open. I mean, if you've got good rationale for a decision you've made, then you can put that into the public domain and say, this is the rationale. And you can say, we stand by it because we know what we're doing. And that is what you get from openness and transparency. Hiding behind failed FOIs and pretending that you don't exist and trying to tell us that you're not allowed to tell us, or that you'd have to kill us afterwards. I think that just starts to sound like it's flimsy at the very least. We shall see whether we get any more information about this. It's, I think, of critical interest to the digital health community that we know how these decisions are made, and they're not made in camera, hidden away by a group of people who we are not allowed to know the names of, when it has such a wide impact on so many thousands of developers across the NHS and all the downstream effects to services that are provided, and our ability to defend ourselves against vendor lock-in, which is something we also have to defend against. It's not quite as sexy and dramatic as cybersecurity threat, but it is just as threatening. If we're locked into one or two vendors over the next decade, we will spend billions, if not hundreds of billions, on software that we could have built ourselves, but we're being told that open source is harmful and we don't want to do that anymore. So I think there's a risk that this is part of an agenda to kind of get open source and get in-house development off the table within our critical national NHS infrastructure. And I don't like that. So I will continue to keep chipping away at this. And I think it's important that this is in the open. That's it for the boring preachy bit. The next episode is going to be probably in a week or so, and actually going to do you a bit of an update on the SCT tool. So in a nutshell, I got frustrated with the state of SNOMED tooling and didn't really feel there was anything I could just download and use on my computer and sort of understand and have a feel that it was like a command line tool in Unix. So I built one, and if you haven't seen that, there is already a video that's a bit of a walkthrough of this SNOMED tool. It's very fast, it's very free, it's very open source. It's getting interesting because I've now added quite a lot more features since that first walkthrough, and so I'll be covering those in the next episode. Okay, well, apologies for the long gap in episodes, and thank you for your time today, and I will see you in the next one.